Ladies, I'm going to say this plainly. There are 9 hygiene mistakes many senior women make right before a doctor's appointment, and I see them all the time. As a female doctor who's worked with thousands of older women, I'm not here to shame anyone, but I am here to help you avoid embarrassment, misdiagnosis, or worse, being misunderstood. Watch until the end, because mistake number 9 is something even I used to overlook, and it could lead to unnecessary testing or even the wrong medication. And if this helps you or reminds you of someone you love, hit like, subscribe, and tell me in the comments which mistake surprised you most. Let's get started. 1. Overcleaning down there with scented products. Let's talk honestly, woman to woman. Many senior women, especially those raised in an era when cleanliness was drilled into them with a mix of pride and shame, still believe that the only way to be presentable for a doctor is to scrub themselves raw. I can't tell you how many times I've had a patient apologize for not being fresh or tell me they used a special soap that morning just in case. Here's the truth. When you overclean your intimate area, especially with scented soaps, wipes, or powders, you're doing more harm than good. Your vagina is one of the smartest parts of your body. It has a natural system to stay clean and balanced. That system relies on healthy bacteria that live there to fight off infections and regulate moisture. When you introduce harsh chemicals or perfumed products, you're wiping out those defenders. The result? Burning, itching, or redness hours later. Increased risk of yeast infections and bacterial vaginosis. And this is important. Lab results that don't reflect your real health. Yes, that overzealous scrubbing or last-minute wipe could throw off your pH so much that your pap smear comes back abnormal or you're prescribed antibiotics you don't need. Some women even end up in tears, thinking they have an STD, when really it was just a reaction to Spring Blossom body wash. So what should you do instead? Use plain warm water and an unscented soap, and only clean the external parts, the vulva, never inside. No douching, no sprays, no powders. Your doctor is far more concerned with your health than your scent. Trust me, we've seen everything. And smelling like roses isn't on the checklist for a good visit. 2. Wearing tight or synthetic underwear to the appointment. Let me tell you a story. I once had a lovely woman in her early 70s come in wearing full shapewear, body-hugging, tight, synthetic material from her bust down to her knees. She told me she didn't want to scare me when she undressed. But here's the thing. She was sweating profusely, had a rash between her thighs, and her skin was red and irritated all over her midsection. And she'd only been wearing it for 2 hours. Now, I completely understand wanting to look put together. Many senior women were raised to dress up for the doctor, but your doctor's office is not a red carpet or a dinner party. Wearing tight, synthetic, or non-breathable fabrics, especially near sensitive areas, can trap sweat and bacteria, cause irritation and inflammation, lead to misleading symptoms like vaginal discharge or skin infections, and even affect your urine test results if the sample gets contaminated by nearby bacteria, not to mention the discomfort. Many older women struggle with temperature regulation, and those tight clothes can cause lightheadedness or even trigger hot flashes. Instead, wear loose-fitting, breathable cotton underwear and clothing to your appointment. Not only will you feel more relaxed, but your skin and your doctor will thank you. We're not judging your outfit. We just want to see the real you, rashes and all, so we can help properly. 3. Applying heavy perfumes or scented lotions. This one's a little sensitive, but so important. There's something so deeply ingrained in women, especially older generations, about not smelling bad. Many women I see, even those in their 80s, will apply generous amounts of perfume, body spray, or scented lotion just before coming into the clinic. Sometimes it's their signature scent. Sometimes it's to cover up a medical concern they don't want noticed. But here's what many don't realize. Those strong smells can interfere with diagnosis. As a doctor, I rely on all my senses, not just what I see or test. Your natural body odor can give me clues about kidney function, a sweet or ammonia-like smell, liver health, certain infections, diabetes complications, even hormone changes. But if your body is masked in lavender, baby powder, or floral body spray, I lose access to those clues. It's like trying to read a map that's been scribbled over. Also consider this. In a small exam room, heavy fragrances can be overwhelming. Many healthcare providers and other patients have sensitivities or allergies. I've had nurses leave the room coughing or with headaches because of overpowering scents. And during cold or flu season, strong smells can make a queasy patient even more nauseous. Here's the rule. A light, unscented deodorant is okay, but skip the perfume, scented lotion, or any fragrance-heavy products before a visit. Your body's natural state is what we're here to examine, not your cosmetic cover-up. For not grooming toenails or checking foot hygiene, let's shift down to an area many people forget, your feet. You may not think your doctor cares about your feet unless you specifically come in for them, but I promise you we do. Especially if you're over 60, your feet can be one of the first areas to show signs of diabetes complications, circulatory issues, skin conditions, bone problems, or even early signs of mobility loss. Unfortunately, many women, especially those who struggle with flexibility or arthritis, don't inspect their feet often. I've had patients come in with blackened toenails, deep fungal infections, bleeding cracks in their heels, or skin so raw it hurts to walk. And often, they didn't even realize it was that bad. Some even try to cover things up by wearing closed shoes without socks, or by putting on thick polish to hide discolored nails, which only makes assessment harder. Before a doctor's visit, especially if you suspect your feet might be looked at, take a moment to trim your nails if you can. Wash and dry thoroughly, especially between the toes. Wear clean, breathable socks, and don't paint over discolored or damaged nails. If you physically can't manage it yourself, it's worth asking a podiatrist or trusted loved one to help. Your feet are carrying you through your golden years. Let's not ignore them when your doctor might spot something life-changing. If only they could see clearly. 5. Skipping deodorant completely before the appointment. Now I know what you're thinking. Didn't she just tell us not to wear strong scents? Yes, but skipping deodorant altogether is the other extreme. And I see it all the time. There's a difference between fragrance and basic hygiene. Some women, in an effort to be pure for the doctor, will show up completely scent-free, including no deodorant, even in the height of summer. While the intention is good, the result can sometimes be, well, a bit much. We're human. We sweat. And as we age, our sweat glands and body chemistry change. Hormonal shifts after menopause can even lead to stronger body odor, especially in the underarms. Combine that with nerves before a medical appointment, and you've got the perfect storm. Here's what I recommend. Use an unscented or lightly scented deodorant. Avoid anything too floral or perfumed. And make sure you're clean and dry under the arms before dressing for your appointment. No one expects you to be perfect, but basic cleanliness goes a long way toward making you feel more comfortable. You won't be distracted by feeling sweaty or self-conscious during your appointment, and we can focus on what really matters, your health. 6. Not brushing teeth or cleaning dentures. Now here's one that many women don't think matters before a doctor's visit because, well, I'm not going to the dentist. But I'll let you in on a little professional secret. Your oral health is one of the biggest windows into the rest of your body. Yes, really. I've had countless patients come in for a routine checkup or to discuss medications. And when we're face to face, I notice signs they didn't even realize were there. Strong breath odor, bleeding gums, or dentures that clearly haven't been cleaned in days. Sometimes there's even visible food buildup. Now, I say this with no judgment. Many women don't realize the role their mouth plays in overall health. But listen carefully. Unclean dentures can lead to mouth sores, fungal infections like thrush, and even affect digestion. Chronic bad breath can be a sign of digestive issues, medication side effects, or even kidney or liver dysfunction. And poor gum health has been directly linked to heart disease and inflammation throughout the body. If you come in with a mouth that hasn't been properly cleaned, it could affect our diagnosis. And it can also impact how confidently you communicate during your visit. I've had women cover their mouths or avoid speaking clearly because they were self-conscious when they should be focusing on getting the help they need. So before your next appointment, brush your teeth well, rinse and soak your dentures properly. Avoid sticky mints or sprays that just mask odor. And if you have trouble cleaning thoroughly due to arthritis or poor grip strength, ask your doctor. We can recommend easy tools to help. A clean mouth makes it easier for you to speak, smile, and breathe easily, and it allows us to notice the signs that could save your life. 7. Using talcum powder or scented powders in private areas. This is a tough one because I know so many senior women grew up with powder as a daily hygiene routine. Back in the day, it was practically handed out in hospital kits and recommended for freshness. But times have changed, and so has our understanding of the risks. Talcum powder, especially when applied near the genitals or under the breasts, has been linked in several studies to serious health concerns, including an increased risk of ovarian cancer. And even beyond the long-term risks, powder clogs skin folds, traps moisture, causes irritation and chafing, and creates a false sense of cleanliness while potentially hiding infection or rash. I've had patients come in for a pelvic exam, and when I lift the sheet, there's a visible layer of powder in their underwear or on their inner thighs. It can interfere with swabs, pap smears, and skin checks. And if we're checking for skin breakdown or yeast infection, the powder can make things look deceptively healthy or worse, cause a reaction that didn't need to happen at all. Now, I get it. Some of you use powder because you sweat more in older age. Others use it to prevent odor or itching in sensitive areas. But there are safer, modern alternatives now. Unscented moisture-wicking creams, gentle barrier creams, or breathable fabrics that do a better job without the risk. If you insist on powder, use cornstarch-based options sparingly and never apply inside the body or directly onto broken skin. But ideally, skip the powder altogether before your doctor's visit. We need to see what's really going on, not what's been dusted over. 8. Forgetting to wash behind ears, neck folds, and underbreasts. This might seem like a small thing, but it's actually a very big deal in senior health. As we age, our skin becomes thinner, more fragile, and more prone to moisture-related irritation. And the places that often get forgotten, the ones you can't easily see or feel, behind the ears, under the breasts, in the folds of the neck, under abdominal overhang, what we sometimes call panus. These are places where sweat, skin oils, and even fungus love to hang out. And if they're not cleaned regularly, especially before a checkup, they can cause unpleasant odor, redness or rawness, yeast infections, skin breakdown that leads to open wounds. I've had women come in for unrelated concerns, and during a quick skin check, we find hidden rashes, peeling, or even infections they had no idea existed because they physically couldn't see or reach those areas. That's not their fault. It's hard to twist, bend, or scrub thoroughly when you're dealing with stiff joints, poor balance, or fear of falling in the shower. But there are tools that can help: long-handled sponges, washcloth gloves, or even shower chairs that give you more control. And on the morning of your doctor's visit, a quick sponge wash of those tucked away areas can make a massive difference, not just for your comfort, but for your doctor's ability to see warning signs. Remember, just because an area is hidden doesn't mean it's harmless. 9. Wearing heavy makeup to cover skin issues. Now, I know this one is a sensitive subject. Many older women, especially those who've always taken pride in their appearance, feel vulnerable without a little face. And I completely understand the desire to feel polished and put together, especially when you're sitting in front of someone in a white coat. But I've got to tell you, when you come in with foundation, blush, powder, and concealer layered on, it makes it very difficult for us to assess your skin properly, and that can have serious consequences. Your skin, especially after 60, tells us a lot. Changes in color can indicate circulation problems, bruising from blood thinners, or even liver issues. Dryness or flakiness might point to thyroid changes or vitamin deficiencies. New moles or pigmentation could be early signs of skin cancer. And even small rashes or redness could be allergic reactions to medications. But when everything is covered with makeup, it's like trying to read a book with all the pages glued together. I've had women come in with what looked like a perfectly smooth face, until I gently wiped a patch and saw an angry rash underneath. One woman had a bleeding mole that she was covering up with concealer, thinking it was just dry skin. It turned out to be a precancerous lesion that we caught just in time. If you're going to a routine doctor's appointment, please consider skipping the makeup that day. Or, at the very least, go light just enough for yourself, but not so much that it hides your natural skin. Trust me, your doctor isn't judging your looks. We want to see your health, not your highlight. And here's the empowering part. When you walk into the clinic as your natural, authentic self, you give your doctor the best chance to help you fully. You're saying, "Here I am. Let's take care of me as I really am." And that's the most beautiful thing you can do for yourself.